If you're over 60 or caring for someone who is, stop what you're doing right now. A major new law just passed in the United States, and it directly affects your money, your health care, your home, and your retirement security. It's called the Elder Care Protection Bill, and most seniors still don't know what's inside it. Today on USA Senior Laws Guide, we're breaking it down section by section in plain English, so you know exactly what changed, what you're now entitled to, and what steps you need to take before any deadlines pass. Let's get into it. For years, American seniors have faced the same frustrations. Prescription drugs priced out of reach, nursing homes with no real accountability, Social Security adjustments that couldn't keep up with the real cost of living, and financial scammers targeting retirees every single day. The Elder Care Protection Bill is Washington's most comprehensive response to those problems in a generation. It covers health care, housing, finances, mental health, and caregiving. And we're going to walk through every major piece right now. Let's start with prescription drug prices, because this is the change that's already making pharmaceutical companies nervous. Here's something that should have changed decades ago. Medicare, which covers over 65 million Americans, was legally banned from negotiating drug prices with pharmaceutical companies. Private insurers could negotiate. The VA could negotiate, but not Medicare. That ends now. Under this bill, Medicare can negotiate prices on a much broader list of medications, and those savings roll out on an accelerated schedule. If you're currently paying hundreds of dollars a month for diabetes, heart, or blood pressure medications, those costs are likely coming down. The bill also caps your annual out-of-pocket drug costs. There is now a legal ceiling on what you can ever be charged in a single year, no matter how many prescriptions you take. For seniors who have been forced to choose between filling a prescription and buying groceries, this is not a small change. This is life-changing. Now, let's talk about Social Security. Your annual cost of living adjustment, what they call COLA, has always been calculated using a formula that tracks how working-age urban employees spend money. Gasoline, electronics, work expenses. But that's not how seniors spend money. You spend more on health care, prescriptions, in-home care, and utilities. Costs that rise faster than almost anything else. This bill pushes to change the inflation index to one that actually reflects senior spending. Over time, that means more accurate and higher annual adjustments to your monthly check. The bill also strengthens Social Security's long-term funding by adjusting the payroll tax cap on higher earners, helping protect the program for current retirees and future generations. Next, nursing home reform. And this section doesn't get nearly enough attention, so pay close attention. Federal reports have repeatedly found that a troubling number of nursing homes have serious violations. Understaffing, sanitation problems, medication errors, and in some cases, outright abuse. Under this bill, nursing homes receiving Medicare or Medicaid funding, which is nearly all of them, must now meet strict minimum staffing ratios. Your loved one will have a real trained caregiver available, not one aide stretched across an entire hallway alone. Fines for violations are dramatically increasing. In the past, penalties were small enough that many facilities simply treated them as a routine cost of doing business. That changes now. Repeat offenders risk losing their Medicare and Medicaid funding entirely. And all inspection reports, staffing records, and violation histories must now be made publicly available. When you're researching a facility for yourself or a loved one, you'll see the real picture, not just the glossy brochure they hand you at the front desk. Now let's talk about elder financial fraud, because this is a silent epidemic that robs American seniors of tens of billions of dollars every single year. Fake IRS calls, Medicare scams, investment fraud, romance scams, even family members exploiting a senior's finances. The FBI consistently ranks elder financial fraud as one of the fastest-growing crimes in America. This bill creates dedicated federal funding to investigate and prosecute these cases. Banks and credit unions are now required to flag suspicious activity on senior accounts. Large, unexpected withdrawals, wire transfers to unknown accounts, sudden changes to account access. These are red flags, and financial institutions now have both the tools and the responsibility to act on them. There's also new funding for public education, because the best protection against scammers is knowing exactly how they operate. On housing, most seniors want to stay in their own home. But homes aren't always built for aging safely. Stairs, narrow doorways, bathrooms without grab bars. These become real hazards over time. This bill significantly expands grant and low-interest loan programs to help eligible seniors modify their homes. Ramps, walk-in showers, wider doorways, better lighting. Modifications that keep you safe, independent, and out of a care facility. The bill also invests in affordable senior housing communities designed around accessibility, health care access, and social connection. Because research shows that chronic loneliness in older adults is as harmful to your health as smoking 15 cigarettes a day. On mental health, many therapists today won't accept Medicare patients because reimbursement rates are simply too low. This bill improves those reimbursement rates and dramatically expands telehealth options. If you live in a rural area or have mobility challenges, you can now access counseling from the comfort of your own home. Grief, chronic pain, fear of losing independence, these are real burdens millions of older Americans carry every day. Help is finally becoming more accessible. There are also major new protections for family caregivers. Right now, there are an estimated 53 million unpaid family caregivers in America. Sons, daughters, spouses, people managing a loved one's care while also working and raising their own families. This bill introduces new tax credits for family caregivers to help recover out-of-pocket care costs. It funds caregiver training programs and expands respite care options so caregivers can take a real break without guilt. A rested caregiver means better care for the senior. Everyone benefits. And on dental, vision, and hearing, original Medicare has never covered routine dental care, eye exams, or hearing aids, a gap that has real health consequences. Untreated gum disease is linked to heart disease and dementia. Hearing loss is one of the biggest risk factors for cognitive decline. These are not optional services. This bill adds new subsidies for hearing aids, expands dental care through federally qualified health centers, and increases funding for vision services through community health programs. It is a real and meaningful step forward. Now, here is the most important part of this entire video. Not every benefit in this bill is automatic. Some require you to apply. Some require you to update your Medicare or Social Security records. Some have enrollment windows that, if missed, cannot be recovered. Start by visiting ssa.gov or your local Social Security office. Then, schedule a free appointment with your state's SHIP counselor. That's your State Health Insurance Assistance Program. It is completely free, unbiased, and available in every single state. These counselors are trained to walk you through exactly these kinds of changes, step by step. And a critical warning before we close. Scammers are already using this bill as bait. If anyone calls, emails, or messages you offering to help you claim new benefits and asks for money or personal information up front, that is a scam. Hang up immediately. Real government services are always free. The Social Security Administration will never call you demanding immediate action. Medicare will never ask for your credit card over the phone. If anything feels off, hang up, close the browser, and call the official number directly. The Elder Care Protection Bill is not a perfect solution. Implementation takes time, and the forces that benefit from the old system will not give up without a fight. But this law is a genuine, meaningful step toward a system that actually works for older Americans. And here on USA Senior Laws Guide, our job is to make sure you know your rights, understand your options, and never get left behind. If this video helped you, share it with a senior you love. Subscribe so you don't miss our updates as this bill rolls out. And drop your questions in the comments below. We read every single one. Stay informed. Stay protected.